This episode of Simple Civics Greenville County is brought to you by Dolly Parton's Imagination Library, providing free books to children 0 to 5 throughout Greenville County. To sign up, visit greenvillefirststeps.org/free books. That's greenvillefirststeps.org/free books.
Have you ever been sitting in traffic on Woodruff Road or navigating a busy intersection in downtown Greenville when you heard the familiar wail of a siren behind you? Like most of us, you probably pulled over, hopefully you did, you let the ambulance pass, and maybe offered a quick thought for the person in the back or the family waiting for them to arrive. But have you stopped to wonder how that specific ambulance knew to be just a few blocks away when that call came in? In a county that covers nearly 800 square miles from the mountains of northern Greenville County, the dense traffic of the I-85 corridor, getting a paramedic to a doorstep in minutes isn't just about driving fast. It's a high-tech game of geographical chess. Greenville County EMS is the busiest system in South Carolina, and they operate under a unique third service model that makes them a standalone pillar of our public safety system. I'm Katie Smith with Greater Good Greenville, and on this episode of Simple Civics Greenville County, I'm talking with Dr. Tom Blackwell, who serves as Executive Director of Greenville County EMS, and Phil Head, who is Director of Clinical Services. They are here to pull back the curtain on how data helps them predict the next emergency, how they're working to keep residents out of the hospital through proactive care, and how you, as a regular citizen, might actually be the most important link in their chain of survival. I am so pleased to be here with Dr. Tom Blackwell and Phil Head, both with EMS, to help fill us in on the incredible scope and service that EMS provides to our county. Thanks to both of you for being here.
Thanks for having us.
Yeah. So Greenville County EMS is the busiest system in South Carolina. You all cover nearly 800 miles of course, dense urban centers and very rural landscapes. And we see ambulances fixed at fire stations, but I know your deployment is much more fluid than that. Can you explain how you all use data and forecasting to ensure an ambulance is in the right place before that call even comes in? And Dr. Blackwell, how about you cover this for us?
Sure. Thank you. It's great to be here, and it's a great question that you asked. We're talking about deployment, and when you talk about that, you want to talk about how many ambulances do we actually need in the field every day, and where do we put them once we got them? So, as far as the number goes, we use a matrix, and I'll try and make this as simple as I can. We do a matrix that we'll take one day, I'll say Sunday. We'll take Sunday, and across the x-axis, we will have every hour of the day from midnight to 1, 1 to 2, 2 to 3, so forth. That goes across the top, and then across the left side on the y-axis, we'll have 20 Sundays in a row, the previous 20 Sundays from the time that we're actually measuring. So we end up with 480 placeholders in this matrix. And what we do, in each placeholder, we put the maximum number of calls that came out during that time frame on that Sunday. Then we'll take the most recent 10 weeks and then the most distant 10 weeks. We'll take the highest number of calls in each of those segments. We'll average them. We'll multiply them by what we call the time on task, which is the time that we receive a 911 call until we have cleared the hospital. So we get the call, we dispatch the truck gets on the scene, takes care of the patient, we transport to the hospital, we turn the patient over, we get the truck ready to go for the next call, we're back in service. Our time is about an hour and 15 minutes. So we multiply those numbers by 1.25. That gives us the minimum amount of trucks that we need in the field. But not every call comes in between 1 and 2.
Right.
It may come in at 12:30 and go till 2:30. So we take 40% of the hour before, 40% of the hour afterwards, and 60% of the actual hour. It's complicated math, but it's 97% predictable as to how many trucks we need in the street. But now that we have our trucks, where do we put them? And we use a program that's actually built right here in South Carolina down in Aiken called Marvelous. Marvelous stands for Mobile Area Routing Vehicle Location Information System. And there are 3 parts to this. And the first is what we call demand forecasting. Fire departments dispatch their units from fixed locations, right? Fire stations, because their primary job responsibility is fire suppression of structures. Well, our primary responsibility is taking care of patients. Structures don't move, people do. So the overall premise of this is we have most of our resources in downtown Greenville, Monday through Friday from 8 to 5, where the population is. In the after hours, we're out in the suburbs because that's where people go. So we don't dispatch all of our resources from fixed locations. We move them around like chess pieces, and it's all based on historical volume. We'll take the last 2 years of data like we have a plan right now. At 10 o'clock on a Monday, we have a plan from 10 to 12 based on the last 2 years of Mondays in May, first, second week in May, where the calls come out. And the map shows us a heat map where it goes from purple, red, yellow, green, and white. Purple meaning you're going to get a call there. And the premise is if I have one ambulance available, where's the crystal ball tell me the next call is coming out? So our dispatchers can see that. So it's real-time system analysis. The third piece of this is intelligent routing. We use TomTom technology. And what that is, if I have a crash at I-85 and Pelham Road, which we have one almost every day there, and I have 3 ambulances on the map that look like they're pretty close, the closest ambulance may not be the one I need because they have already gone onto the interstate. They have to go to the next exit, turn around, come all the way back. The next closest ambulance is blocked because of traffic, because of the crash. And this third ambulance that on the map looks like it's farthest away, that's actually the closest because they have a direct route with no traffic to get there. So Marvelous kind of tells us using that technology, which is the closest truck to recommend for dispatch. So we do use data to tell me how many trucks we need, and we use data to say where we put them. And it's all based on historical call volume. And it goes to 85 to 97% sensitivity on accurate prediction.
That blows my mind that you have that precise of data that you're using as a crystal ball, as you said. And it actually makes a ton of sense. I mean, we could all imagine on July 4th, there are likely to be incidents between 8 and midnight as people are lighting fireworks. But I could also imagine that a Saturday on a sunny May near the Swamp Rabbit Trail, you might be more likely to have bike accidents or whatever it may be. So it makes me feel good as a resident knowing that when I call, you're already anticipating I might have a need and be close to me.
Absolutely.
All right, so we usually think of EMS as a reactive service, kind of the scenarios we just described, that you're anticipating there might be an accident at Pelham Road and 85, but you don't know. You'll come when we call. But the mobile integrated health program that you have seems to flip that on its head by being proactive. How are you all working with residents in their homes to manage the chronic conditions or post-hospital care that oftentimes does cause a 911 call? Phil, can you talk about that?
Absolutely. This is one of my favorite things to talk about. So our community paramedics engage in this idea of what we call mobile integrated health. And that is basically trying to provide patient-centered care and meet patients where they are. And so we have a few subsets of that. We work with both of our healthcare systems, Prisma Health and Bon Secours St. Francis, to engage with patients. And specifically, our PATHS program, which is our pre-hospital assisted treatment and healthcare services program. We were awarded a grant from the Blue Cross Blue Shield Foundation, which basically allowed us to hire 2 community paramedics and a nurse practitioner. So when a call comes into our 911 center, that is a low acuity call. Our community paramedic or nurse practitioner is going to engage with that patient in real time on the phone, listen to the issues, the complaints, what's medically going on, and make a decision of how to intervene. We've had some success engaging with patients over the phone. We provide care advice, support, connection to services. And sometimes that patient is satisfied and they don't have any other needs at that point. As a secondary subset of that, and what we see most of the time is that our community paramedic will go out to the house. They will provide an assessment, they'll provide treatments and connection to care in some way, shape, or form. In many instances, we're able to take care of the patient's needs at their home, and then they don't have to go to the hospital. They don't need an ambulance. The third option that we have is that we can telehealth with a nurse practitioner if the need arises. So right there in the house, we can set up the telehealth interface, provide that care, and help the patient get, their needs met in that moment. Every once in a while, our nurse practitioner will ride on the truck as well. And so she's been able to go out and engage with patients, see them in the field, has done suturing, a couple of times. And again, just provide that level of care for patients where they are. But no matter what aspect of this program, the heart of it is to try to connect patients to specialty care, primary care, whatever their needs are in that moment. We want to try to provide it in an episodic care moment, but then connect them to resources afterwards. And it has been a really exciting program. As an alternate side of our community paramedicine program, we do a lot of work with addiction and recovery. Folks that have opiate addiction and other things. We work very closely with the Phoenix Center. We work with Prisma Health Addiction and Recovery. We're helping provide treatments. We will go see patients in the that have an opiate addiction if they're at our detention center. We will go and meet those patients and meet those folks and have a conversation with them. And actually, when they get released or bonded out, we have about an 8 to 12% success rate on them reaching out and then connecting them to services outside of that. So that's been a fantastic outreach program, and just going and seeing people where they are and connecting them to care. It's been an amazing process. We also work with readmissions for hospitals to try to help them reduce some readmissions for some certain chronic diseases. And we also work with high 911 utilizers. If somebody calls 911 on a regular basis, we do try to engage with them to see, can we do a home safety inspection? Can we do medication reconciliation? Can we provide some care advice, connection to care, to try to keep them healthy and happy where they are?
I'm grateful for all of that as a fellow citizen and taxpayer. But really, when I think about my grandmother or my brother and sister or anyone who could be needing that kind of assistance, that it's being done in a more appropriate setting, but also with such care and in a way that really meets the patient's needs. Thank you for that innovation. And of course, the Blue Cross Blue Shield of South Carolina Foundation. What a great grant to have made.
There's also the Community Foundation of Greenville did give us money for a vehicle as well, which we've been able to stock and put out there. So those two together have provided that.
So I happen to see that you all have a call center, MedCom, which is where 911 calls go, that has earned an accreditation as a Center of Excellence by the International Academies of Emergency Dispatch. So congratulations and thank you. What kind of training goes into having a staff that can achieve such a high standard? And how does that end up leading to better care for citizens during emergency situations? Dr. Blackwell, I feel like this is something you could cover for us.
Our communications center called MedCom is what we call a secondary PSAP, or public safety answering point. If you call 911 in any of the 6 municipalities, you're going to get that municipality's primary PSAP. If you're in the unincorporated areas outside those cities, you'll get the sheriff's department as the primary PSAP. That if it's a medical call, or 18 of the 31 fire departments that we dispatch for, those calls are routed directly to EMS immediately. So we take that call, and we use a program called the Medical Priority Dispatch System. We interrogate callers. We ask, where are you and what is your callback number? So if there's a sudden disconnect, we'll know where to go and where to send resources. And then we ask the status of your age, your chief complaint, and the status of consciousness and breathing. Now, if we're talking to the patient, we obviously know
can glean what that might be.
They're fine at that point. But sometimes we're talking to a family member or a bystander. So we ascertain that information. And depending on the chief complaint, we then go to asking anywhere between 1 to 8 questions called key questions, which really dive into that chief complaint. So if you're having chest pain, we have 6 or 7 questions really focusing on chest pain or shortness of breath or back pain or a traumatic injury of some form. And the whole purpose of that is to triage that call and to categorize it into what type of response. Meaning, are we going out with lights and siren, or are we just going out routinely without warning lights and siren? Because every time we pull out with lights and siren, there's a public health risk, because people are getting out of the way, and sometimes they have secondary crashes because of us coming down the street at excessive speeds. So we're careful about those things. And so this is a system that's used throughout the world, actually. It was developed in Salt Lake City, and it's been going on for 3 or 4 decades, I guess. And we're part of that. And to be part of that system, you have to review X number of calls to make sure we're categorizing the calls the right way, and we're sending them out, our crews out the right way with the right mode. And so we report all that data. And if you do a certain percentage of those call reviews and you make improvements, you send those in to the national academies and they'll review it, and you get a center of excellence. And there are only 2 in South Carolina, and we're one of those. Charleston is the other. And so there are 31 other centers of excellence across the country, and there's more abroad as well. But it's something that we've achieved for many, many years here, because we go above and beyond what the academy requires of us to make sure we're doing the right things. And we train our people on regular in-service continuing education training to make sure they understand all the protocols and how we're doing. We have supervisors in the room around the clock and listening in on calls, making sure our telecommunicators are doing the right thing, because not only are we getting calls and dispatching resources, we're also providing what's called post-dispatch instructions and pre-arrival instructions. Post-dispatch are what we tell everybody. Don't give the patient anything to eat or drink until we get there. If their condition changes, call us back. Get their medications together, put them in a bag so we can bring them to the hospital with the patient. If you have loose animals, put them in a back room so we're not attacked by them. If it's at night and you hear the siren, flip your porch lights on and off so we know where to go, just to speed that response. The pre-arrival instructions are truly life-saving
I
instructions
could
that we give.
imagine.
It's how to do CPR if needed. We'll walk a bystander who knows nothing about cardiopulmonary resuscitation if someone has collapsed from a heart attack. We'll teach them on the phone how to do chest compressions and how to bring that person hopefully back to life, how to control hemorrhage, how to relieve a choking victim with a Heimlich maneuver, or how to assist in childbirth, where we can actually teach a spouse how to deliver a baby. By doing all these things, we submit all this data and information to Salt Lake, and they review, and we're doing such a great job in our comm center. We get that Center of Excellence Award every year.
Well, we are grateful because you help all of us manage emergencies in our own homes well and be partners to you as you're trying to take care of us. So thank you for that. Well, all of what you just described is so impressive, and it's because of the great team that you have. And I would love to talk a little bit about that team, how you recruit and how you retain them, because I can imagine we are growing so much. So you're needing a bigger team. It's a high pressure job. It's one that requires a very specific person. I wonder, Phil, can you talk a little bit about workforce recruitment and retention?
Yeah, I think one of the best things that we have done at Greenville County EMS is starting our EMS academies. Now, we have 2 different subsets of that academy. We have our EMT academy, and then we have our paramedic academy. The EMT academy is we will hire somebody, they go through an interview process and some testing and some other things, but we will hire that employee and then basically pay them to go through our EMT program. It's about a 4-month program, and then they do some transitional training, and then they're working under the care of one of our trainers, and then they're released to care for patients. We've probably run 8 or 9 classes historically, and this has been one of the best things that we can do to take people, from whatever job or aspect of their life that they're at, to make a transition to EMS. And we've had no problem recruiting into that program, and it has been great. On the paramedic side, we have partnered with Low Country EMS, who basically has an asynchronous educational program where they offer a lot of the paramedic education in an online pre-recorded format. And so our employees go through that, and then we get them for 4 hours a week and then 7 hours a week, respectively, to do some reinforcement, case studies, power lectures, some formative and summative skill type work to take them through that curriculum. We have graduated 3 very successful classes, and we have our 4th program now. So from a workforce standpoint, there was an influx of people historically from regional offices or technical colleges, and just with the growing demand, we had a need to start our own academies, and they have been great in driving our workforce. And it's been very good.
What a great program. And some of you might be listening and thinking, gosh, I might be interested in a career path like this. So we can put a link in the show notes to the website where people can learn more. Okay, so once these folks come on the job, it is a hard job, I would imagine. And certainly folks are probably drawn to it because they enjoy that pressure and willingness to serve. But how do you keep them once they're in the seat?
EMS is a very complicated job in the sense that it's very busy, and you are definitely going to respond to some high acuity calls, some very sick patients that are in some type of crisis and emergency. So from that standpoint, kind of like Dr. Blackwell talked about earlier, we try to manage the call volume and their workload. I will say that our supervisors are fantastic at rounding with people, kind of keeping tabs on them, seeing what's going on. They follow up with them. If there's a high acuity call or a call that, could be disturbing in a lot of different ways, our supervisors are great about following up with employees. We have invested in a company called Responder Services, to where if our employees need any types of counseling or follow-up, they can engage in those services. We have definitely worked on creating a culture where people can say, hey, this did bother me in some way, shape, or form, and I would like to talk about it. We've developed a peer support team. So if an employee did not want to engage with that company and they wanted to speak to a peer, those folks have been through some training on how to connect and resources and support people and to be there for each other. And I think those social connections that have been established in EMS are huge for just kind of meeting your employees where they are. It's important to meet the patients, but we need to meet our employees where they are as well. And I think our team does a great job of doing that.
Right now, we're 96% of our paramedic positions are filled. 83% of our EMT positions are filled, and 93% of our telecommunicator positions are filled. This is pretty amazing if you look across the country where there are shortages all over. I have a manager, my safety and compliance manager, told me, he came in the office the other day and said, he's been here for 20 years, 25 years, and he said he's never seen Greenville County close to full staff. That we always have openings, always, and we're really close. With our next EMT academy that graduates and our next paramedic academy, depending on what attrition we have, which we're below national averages on our attrition, we could have 100% of our positions filled in Greenville County. And that's really a testament to how we take care of our employees and make sure they're happy and they have all the resources they need to do their job effectively.
Well, that is so commendable and also makes such a difference for all of us who live here. So thank you. Simple Civics Greenville County is a podcast about government, about local and state government, which of course EMS is a part of, but it's a little bit unique. It's a third service municipal department. That's an organizational structure that's probably unfamiliar to many. So Tom, could you talk about how you are a standalone department alongside police and fire, and how that impacts your funding and your service delivery?
What we're talking about with the question is the system design of an EMS system. And if you look across the country, it's typical that the county government is responsible for EMS. It doesn't mean they're going to run it, but they are ultimately responsible for ensuring that EMS is delivered to the community. So Greenville County EMS was started in 1975. And we just celebrated our 50th anniversary last year, which was pretty great. But the county at that time decided that we'll run the system. And so that's where third service comes in. And we've been in that system design since 1975. Police is known as first service. Fire is known as second service. And EMS, third service. So that's where the name comes from. But the county makes the decision on how EMS is going to be provided. So if they decide to handle it themselves, you become a third service model. And the third service model is very common in the southeastern United States. So a lot of the systems in North Carolina and South Carolina, a few in Florida and many in Georgia, are all third service municipal organizations. But the county can decide to give it to someone else, like another response agency. Typical would be a fire department. EMS doesn't go to police departments. Police don't run EMS anymore. The last two were New Orleans and Pittsburgh, and the police have just gotten out of that. They're too busy doing law enforcement activities. But fire departments, they're in the emergency response business. They're strategically placed throughout a community. So way back in time, and even today, Some third service organizations have transitioned to fire department-based services. Fort Worth, they just did that not too long ago. So fire departments are a natural site to put EMS. Counties can decide to contract it out to another quasi-government organization that's called a public utility model, which is like a water company or the gas company. It still has some county government oversight, but it's run by a board, if you will, with contract specifications. Or they can farm it out. They can issue an RFP, request for proposal, and let private fee-for-service organizations bid on the contract, and they can take it for 1, 2, 3, 5 years, depending on what the contract looks like. In the industry, they say, you've seen one EMS system, you've seen one EMS system. So they're all different. Being a third service model for us, I think it's a great model. I like it because it gives us our own distinct entity in the community. We have a dedicated budget, a dedicated leadership and organizational chart, and we have a civilian workforce that does all the patient care for us. Unlike fire-based systems where personnel, firefighters often juggle between dual roles as firefighting versus medical care in the street, third service models allow for a single mission, which is strictly patient care. Our staff are hired specifically to provide medical care, whereas firefighters may perform that EMS job as an additional duty. Most firefighters go to the fire academy to learn fire suppression. They run into buildings we're running out, so they're truly heroes. But if they're doing EMS, sometimes they're into it, other times they're not into it. Fire departments, about 80 to 85% of their business are medical calls because big buildings aren't burning down anymore. They've done such an awesome job of arson investigations, sprinkler systems, early detection, smoke detectors. All those things have kept big buildings from burning down.
Construction techniques, right.
All those things. So EMS is another area that they like to get into because it allows them to serve their community in addition to fire suppression. But anyhow, the third service agency allows us to foster a strong professional identity, and we can have specialized career paths. We have tactical EMS if paramedics want to work with our law enforcement for high-risk interventions, SWAT teams, if you will. We have a bicycle response team. We have a search and rescue team. And we have a new team that takes care of the sheriff's office canines, the German shepherds and bloodhounds that work for the sheriff's department. We have a team that can take care of them if they get sick out on a prolonged wilderness rescue or something. So
amazing.
We have different areas that our medics can venture into depending on their interests. We also have our own dedicated budget within county. We're not competing with other entities or other services. Like if we were under the fire department, we would be competing with additional apparatus, equipment, personnel, et cetera. So we have our own budget. Again, we have our own organizational chart, and we're more autonomous, and we can change things easily on the fly. If we see evidence-based medicine going in a certain direction, we can make the changes pretty quickly. We don't have to vet it up through a very large, cumbersome chain of command, if you will, that we can make those changes based on new and emerging medical technology. So
that's great.
It's good.
Well, the civics nerd in me loves that information. And I love so much what you do for this community. Really, I'm grateful to both of you for your leadership and for all the men and women who serve. All of us owe you a huge debt of gratitude. Well, thank you for this information. We really appreciate you taking the time to talk with us and for all that you do.
Thank you for having us.
Thank you, Kay. And thank you for what you do with Greater Good Greenville. You really get the message out to the people, and I think it's important. A lot of people, they call us ambulance drivers because that's what we used to be many, many, many years ago. So you've taken the opportunity to enlighten the public, I think, that we're more sophisticated today in what we do and how we deliver care to this community. So thank you.
Hi, Simple Civics Greenville County listeners, Nathaniel here. If you've made it this far, then we think you'll really love our newsletter. Sign up for bonus content, updates, and more right in your inbox. Look for the link in the description that says newsletter to sign up, or visit us at simplecivicsgreenvillecounty.org. Find the link in the menu that says newsletter and sign up there. We'll see you again next week.